Welcome to another edition of Learning to See, Seeing to Learn with Dr. Patrick Quaid and Cari Fairley. Dr. Quaid is the founder of the View Cubed Vision Therapy Centers. They're located in Guelph and North York, Ontario. Cari was a teacher for more than 30 years in Ontario as well, in 3 different school boards. Now recently retired. Congratulations, Cari.
Thank you.
One of the topics that's very important to parents and to teachers in the classroom: what is it like to deal with students who are struggling to learn, and how does their struggle impact their behaviors? Cari, tell us about some of your experiences when you've had students who are otherwise very bright and very effective when you talk to them, but they start struggling and you start to see that pattern that we've all seen as parents and teachers where the behaviors start to change.
Well, in a lot of what I've seen, and I have worked mostly in inner city schools. So kids from difficult backgrounds, have a lot of challenges. When they are really, really frustrated, you get behavior. In kindergarten, I taught that for 10 years. And the kids are just learning, phonetics and learning to read and write and very, very basic skills. You would still get a lot of that frustration if it was difficult for them. If something's easy, they enjoy doing it and they want to keep doing it. If something's frustrating, you get behaviors. As I worked into the older grades, a lot of the behaviors that I was seeing were mild or severe. You would find that some kids would just tune out. And of course, then they start getting into trouble because the teacher assumes that they're not listening, they're not interested, they're not trying, right? But sometimes it's just too much for them. I had one girl who had such problems with her vision that she literally, it hurt her eyes. Her eyes were sore and she would look down. And at first I thought she's really, a behavior problem. But it turned out, no, she would explain it to me. At least she did. Sometimes the kids don't. Sometimes you just get them exploding, or the stuff gets thrown off the desk onto the floor and you have to deal with that. In her case, she just literally would put her face down. She'd cover her eyes and close her eyes. But then I'd have to ask her. So I thought, give the kid a chance, see what's going on. I'd ask her some questions, and fortunately she was also auditory. So she was listening to what was going on and she could answer the questions. So I would let her sit there with her eyes down. But a lot of times teachers will get frustrated because they expect a certain behavior from a child to say they're doing well, they're learning, they're understanding. But as I said, I have had kids clear desks. I have had kids take temper tantrums where we've literally, in some of the schools, literally had to evacuate the classroom because the child actually went violent because they were so frustrated with what they were doing. The kids, and unfortunately what starts to happen is the kids really they take it internally. They call themselves stupid. They call themselves dumb. They don't think that they're capable of doing this. And I get the parents putting pressure on these kids to say, you've got to try harder. You've got to do this. And a lot of times I become the intermediary with the parents to say, look, there's something else going on here. The reason for their frustration is maybe, again, this thing. There's something going on here. There's a missing piece.
Right.
And so, you get this range of behavior, and often kids will get put onto IEPs or sent to the office or sent home, or behavior and safety plans will be put in place because a child just can't handle the frustration of not being able to succeed, and they compare themselves to other kids in the classroom.
Yeah.
And it's hard.
Dr. Quaid, some thoughts on dealing with kids who struggle to learn and some of the things you've observed from your academic and research background, as well as from your clinical experience?
Well, I think Cari's touching on something very important there, because what we've seen is, I mean, if you look at the research, ADD, for example, there was a paper published in 2005. Dave Granite was the author. They looked at a sample size of 266 kids with ADD diagnosed. And remember, ADD is a symptom-based diagnosis. There's no objective test. You can't do a blood test. You can't do. It's really based on behavior. And what they looked at was the DSM. So this is the the questionnaire that you give when you're trying to determine if somebody has an ADD tendency. And what Dave Granite showed was that nearly 5 out of the 9, it's now the DSM-5, but at the time it was the DSM-4, 5 out of the 9 symptoms of ADHD overlap with the symptoms of eye teaming dysfunction. And he only looked at one condition called convergence insufficiency, which is difficulty pulling my eyes inwards. And what they found is that in the general population, there's an incidence of convergence insufficiency of about 2 to 3%, but in the ADHD population, it was 15.9%. So they looked at it and said, well, hold on a second. We have a much higher incidence of just this one eye teaming disorder in kids that are diagnosed with an attentional issue. So to Cari's point, I think, and I don't want to overgeneralize here, but I think, there are differences by child, but I think in general, what I've heard from parents, and it does tend to differ whether it's a male or female. And what I find is, in general, there are exceptions, in general, the males tend to disrupt to distract. So they will disrupt to say, I can't do something. I'm either going to become the class clown, or I'm just going to act out. And that's the kid who's brushing books off the desk. I'm done. What you find with a lot of the female patients, they will be the ones that you describe, where they kind of put their head down. They don't really want to distract or disrupt the classroom, but they kind of go into themselves. But what I've heard from parents is the females will hold, it's almost like they'll bottle it together all day. Then they'll go home and they will actually let loose on the people that they're the most comfortable with, the parents. So the parents end up getting the brunt of it. So I find, again, I'm not generalizing, but the trend I've heard in the clinic is the males tend to be more disruptive in the classroom, whereas the females tend to be more, the parents are kind of confused because the kid comes home and it's like they just let loose because they're around the people that they trust. And it's interesting when you see that pattern, because when you look at the percentage of children that are put on ADHD meds, male versus female, there's a very heavy predominance of males. And I think, it's interesting when you look at that pattern, you say, well, we don't really see any difference in incidence in eye teaming disorders between males and females. And it might be, to your point, Cari, it might be more the behavioral characteristics that are being demonstrated and when they're being demonstrated and to whom, that is starting that conversation of, well, have you had little Johnny tested for ADD? And I'm not saying, to be clear, I'm not saying attention deficit disorder doesn't exist. What I'm saying is, the DSM says, in the absence of other neurosensory disorders, the following symptoms apply for ADHD. So that's a really important statement. In the absence of other neurosensory disorders. So what it's basically saying is, if there's an eye teaming problem, you cannot diagnose ADHD until you deal with that, because there's an overlap in the symptomatology. And I think that gets overlooked a lot. And I think when these kids get frustrated in the classroom, I think it's really important to look at the big picture.
Yeah, absolutely. And you're so correct. I have so many examples of, as soon as you were talking, it was like, this child was a girl and the parents talked about that. This was a boy and he acted out in class. He needed a timeout. Most of the kids that I would give fidget spinners to, or, squishy balls, or they would have those little cards where I need a timeout. I'm frustrated. I'm going to blow. And then, the aide would take them out for a little walk up and down the hall. Those tended to be the boys. So it is very, very true that there are patterns in this, and just in the way that they display their frustrations. It's hard to get the kids to talk about it because, as you said, they think what they see is normal. Right. They think everybody sees that.
Yeah, and I think there's also the point of something called peripheral awareness. Now, my daughter's 8, and we use the term magic eyesight to her, so she's like, "Ooh, that sounds cool." So what I usually say is, if you're looking at someone and something's happening off to the side, you don't have to look over there to figure out what's going on. You're looking here, and in your peripheral vision, you can still say, "Yep, there's somebody moving over here, and they're doing X, Y, Z." What I find is a lot of kids with eye teaming problems, they're not very confident with their peripheral vision. So if they're looking at the teacher and something moves over here, they're gone. It's like squirrel, right?
Oh, it is. Yes.
Yeah. And then there's other, they're all over the place. And then you see
their eyes and I'm like, hello, I'm here.
Yeah. And then you see some other kids who are looking straight ahead. Something moves and like, they know, that's a kid over there doing, but they're dead locked on the teacher. So I always have this question of what exactly is attention? we throw that term around, and to me, attention is, all of my other sensory processes are working properly to the level where it's almost like a RAM on a computer. You got hardware and software, and then your RAM is like your minute to minute. So if there's something wrong with the hardware and software, the RAM drops. So your executive function or your attention is almost like the RAM. So if everything else is working properly, your attention can be maintained on what you're doing. But if there's something, and again, vision is 40 to 50% of the human brain. If that visual system is malfunctioning, it means the brain now has to triage to that. So your RAM drops, and now the kid has less capacity to engage in the task.
Well, this has been great. Thank you both for your contributions, some ideas here. There's so much more to learn about all of this from not only Dr. Quaid, but also Cari and the other contributors who've made this book something that's a great resource for both parents and teachers and other professionals who are looking at how children learn and the impact of that on their future careers, on their self-esteem, on their happiness, on their success in life. We've been talking to Cari Fairley, a retired teacher in Ontario, and Dr. Patrick Quaid, the author of the book, Learning to See, Seeing to Learn. Join us again for another episode when we come back.
Thank you.
Thank you.